Okay, hey, let's talk femur here. Parts to know. First of all, we're looking at a femur. Here would be that superior end or the top. Our inferior end would be down here. We see the head of the femur is here. That's that ball and socket that's going to go into the hip joint. So that means that this is the medial side, and then this would be the lateral side, so toward the outside. So we're looking at a right femur here. Okay. First up, the ball on top, that is the head of the femur. Okay, you can see it does make a nice smooth ball joint there, and here's actually where that ligament would insert that goes into your hip. All right, working in from the head, we have two huge notches. All right, one's on the top on the lateral side, the other one's inferior and medial. Okay, remember you have some huge leg muscles and they're going to need a solid anchor point. So we have the greater trochanter is this huge lump up top. Okay, I think it looks even better from behind, from the backside view here. There's that greater trochanter. And then we have the lesser trochanter down here. Okay, much smaller, still a good anchor spot for a lot of muscles there. If we look at the posterior side or the back of the femur, we have this ridge going all the way down it here. That is the Linea Aspera, is this ridge going all the way down on the back side. And then as we move our focus toward the bottom of the femur, we can see where this is going to eventually make the top portion of our knee joint. I think one thing that's interesting, you can even see it on camera. It's much smoother on the inside than it is here. This is where that articular cartilage would be hooked onto, so that knee cartilage would be in there. Think about how much impact your knees have throughout your life. They need a lot of cushion there. Okay, so things that we would see on this. One, we have our two condyles again. Okay, we have our two condyles. Here's our medial condyle. Just keep it on the discolored portion here. The medial condyle toward the middle, then the lateral condyle towards the side. If we flip this femur over, we have this intercondylar fossa there. It's this big groove in between the two condyles on the back side of the knee. And then last but not least, you can see I have a tab on it. We have these two lumps that are bone tissue. They wouldn't be covered with cartilage. One's here on the medial side, one's on the lateral side. We call those the medial and the lateral epicondyles. Okay, so from the whole femur view again, medial and lateral epicondyles there. Once again, just another projection for muscle to attach onto.